I've been conducting research on human-animal interactions since the 1970s and have been looking at how animals affect people's health. Basically, my research is done from a biopsychosocial perspective, which means I am interested in looking at how social factors, how psychological factors, and how physical factors interact in determining health. My first research was looking at heart disease and survival, and we looked at the influence of pet ownership as well as the influence of disease severity, and found that pet ownership was an important predictor of survival beyond the effect of disease severity. Overall, people who own pets are more likely to survive when they've had a heart attack than people who don't own pets, and we've shown that in 3 different studies. Interestingly, we found the effect of pet ownership greater for people who were depressed compared with people who weren't depressed. So people who were depressed were more likely to benefit from the effect of pet ownership than people who weren't. I just presented a study looking at the effects of visiting pets on residents of assisted living facilities. We compared the effect of having a dog visit twice a week for 12 weeks with the effect of a reminiscing group. We found that people who had dog visits had improvements in depression and in physical activity compared with the people who had a reminiscing group. We also found that the amount of improvement in depression was related to the way the people interacted with the animals. People who interacted more, who talked to them more, were more likely to improve than people who didn't.
Do you have any personal stories that you've observed with therapy dogs?
I have a lot of reports from the clinicians who actually are interacting with the dogs. And they tell me just little stories about how the pets interact with the people they come to see in the assisted living facilities or in the nursing homes. And they tell me what a difference it makes to individual people. We get reports that the residents are very unhappy after our studies end, and they want the dogs to come back and visit, even though it's not part of the study. And we do that. We bring the dogs back occasionally to visit the people. There was one gentleman who was in a nursing home who hadn't talked to anybody the whole time he'd been there, and he'd been there for several months. And when a dog came in and visited, he talked to the dog. Unfortunately, many of the data we have are from studies that really were on small sample sizes. They weren't very well designed. People believe that pets are good for them, and they believe that visiting animals should help people, and they tend not to really look at them in a critical way. So what's needed right now is to be able to conduct some more larger scale studies, to be designing them well, and to be able to really start to examine how people do benefit and how people don't benefit. We need to look at, for example, whether they help with depression, whether they help with anxiety, and then use the interventions for the people who can benefit and not use the interventions for people who don't like dogs. When we talk about regular medicine right now, we talk about tailored interventions. We talk about personalized medicine. We talk about using specific therapies for people who have specific characteristics. And we sort of have to talk about human-animal interaction interventions in those same ways. One of the things that's happening is that we tend to look at the effects of pet ownership in younger populations, and we also tend to look at the effect of human-animal interventions in older adults who are institutionalized. But what hasn't been really studied well is the effects of pet ownership on people who are healthy and aging. I've just started a study to look at a group of healthy adults and see how they change as they age, and be able to see whether people who own pets age more slowly than people who don't own pets. Perhaps cognitive impairment, which we know happens over people's lifetimes, will be slower in people who own pets than people who don't own pets. We want to look similarly if declines in the ability to have physical function go slower in people who own pets than people who don't own pets. The study of healthy aging is a piggyback on the National Institutes of Aging's Baltimore longitudinal study of aging, and it's funded by Mars and Waltham.